Hi, my name is Alice Pena, and this is my health literacy assignment for Pharmacology 1032. In this assignment, I'm going to be incorporating aspects of medication reconciliation and the teach-back method. And as my patient, this is Molly Banks, and we're going to go ahead and get started. So, good morning, Ms. Banks. I just wanted to come in and ask you a few questions and assess your comprehension about the medication that you've been prescribed.
Okay.
And I just wanted to come in and see if you knew why you're taking this medication and how. So, can you let me know what medication you're taking?
Yeah, it's called Leuvotharoxin.
Yeah, so you are taking Leuvotharoxin, and I do have with me a little medication information sheet specifically designed for patients. And it just kind of runs through about what we're going to talk about today. And if you have any questions throughout this little meeting, please don't hesitate to ask.
Yes, ma'am.
All right, so do you know why you've been prescribed Leuvotharoxin?
Yeah, my thyroid does not produce enough hormones.
Okay, yeah. So usually that is why this medication is prescribed. It's prescribed to add more thyroid hormone to the body. And it is given when your thyroid does not produce enough of its own hormone, and it works by replacing that hormone that your body would normally produce on its own.
Okay.
And can you tell me a little bit about how you're taking this medication?
Yeah, I take it about 30 minutes before breakfast every morning.
Okay, yeah, and you are taking it right, and it is important to take it before breakfast because it does work best on an empty stomach, usually 30 to 60 minutes before breakfast. And you also want to swallow it whole. You don't want to alter it in any way unless the doctor has specifically told you otherwise. And can you tell me a little bit if you're taking it with water or any other fluid?
Yeah, I take it normally with a full glass of water every morning.
Okay, yeah, and you should definitely keep doing that. It is important to take it with a full glass of water, usually 8 ounces, because the tablet can dissolve really quickly and it could swell in your throat.
Yeah.
All right, and you never want to take more or less of it or take it more often than what's already prescribed by your doctor.
Okay.
So do you know, can you tell me a little bit of some side effects that you know for this medication, some common side effects you might want to watch out for?
Yeah, so anxiety is one of them, and increased appetite is one of them.
Yeah, those are some common side effects, but there also includes a little more.
Okay.
So on the handout, it does talk about you might experience increased appetite, leg cramps, muscle pain or weakness, the shakiness and anxiety.
Okay.
So you definitely want to watch out for those. But can you also tell me about some side effects that you might want to call your healthcare provider for?
Yeah, so allergic reactions, I would guess, and shortness of breath.
Yeah, those are 2 really big ones that you definitely want to call right away for. So with the allergic reactions, they're going to present itself as like a rash, hives, itching, blistering, peeling.
Okay.
You can also experience trouble breathing or swallowing, and those are really big.
Okay.
And some signs of high blood pressure like headache or dizziness.
Okay.
All right, so I am going to give you this little handout, and it does talk about, you know, just the brand name, the generic name, and it also has warnings, like you don't want to use this drug to treat obesity or for weight loss, how it's prescribed, the side effects, and can you tell me again when you should take this medication?
Yeah, about 30 minutes to an hour before breakfast.
Okay, and can you also tell me what are some signs of an allergic reaction that you want to call the healthcare provider for right away?
Yeah, rash, hives, itchiness, and blistering, right?
Yeah, so those are some, but just to reiterate, rash, hives, itching, blistering, or peeling skin.
Peeling skin, got you.
All right, but yeah, this handout is just going to run through everything in case you ever want to remind yourself or read back on it, and it's also going to tell you about where to store it. You want to store it at room temperature, away from any heat or moisture.
Yeah.
Okay, so I'm going to give you this, and you also don't want to share this medication with anyone, and that's important.
Okay.
And I do notice that you have your medication with you. Is it okay if we go through it a little bit?
Yeah, for sure.
Okay, so can you just kind of read to me where the instructions are?
Yeah, so it's right below my name, and it says take 1 tablet by mouth every morning before breakfast.
Okay, and then can you tell me where the name and the amount that you're taking is at?
Yeah, so the name is right here at the bottom, and it says Leuvotharoxin and 100. And can you remind me again what this means?
MCG stands for micrograms.
Micrograms, got you.
Okay.
So I take Leuvotharoxin 100 micrograms.
Okay. And when you store this medication, where do you, can you tell me again where you want to store it?
Yeah, in a cool, dry place.
Yeah, away from heat and moisture. You don't want to affect the medicine in any way.
Got you.
All right, do you have any questions for me before we end the meeting?
Yeah, just one. With the high blood pressure, what are signs and symptoms I should be aware of?
You just want to watch out for some dizziness and headaches that you might experience.
Okay, got you.
All right. Well, I want to thank you for letting me come in here and talk to you about your medication.
Yes, ma'am. Thank you. I feel like I have so much, a better understanding of my medication now because of you.
All right. Thank you.
Thank you.